Now, there are a lot of conditions, except from the atherosclerotic plaque condition that we've already discussed, that can cause the cardiac insufficiencies or the damage to the cardiac tissue. That can be, again, a compromising situation for the individual himself or herself, and that can cause a sudden fatal condition in a particular case. So we're going to discuss the other anomalies or the conditions of the myocarditis, the infections of the cardiac muscle, and the other cardiomyopathies that include the pathology of the cardiac musculature that is involved in a lot of cases. So we'll be discussing all of these over here in this section. Moving on, basically, we'll be discussing the sudden death from these cardiomyopathies and what are these cardiomyopathies specifically that we're talking about. We'll be discussing the myocarditis or the infection to the cardiac muscle. Again, we'll be discussing the death in the old age that is known as the senile myocardium. That is again stressed over here in this section. So the sudden death from the cardiomyopathies, it's discussed over here. We have basically a heterogeneous group of diseases of the myocardium that is associated with the cardiac dysfunction. Moreover, we're discussing the large heart in the absence of the hypertension or the valve lesions. That will be discussed over here, and the atherosclerotic coronary artery disease that is already discussed in the previous sections quite extensively, how this disease occurs and what are the complications of these atherosclerotic plaques ranging from the hemorrhages to the ulcerations, and all of these basically are concluded over here that these myopathies can basically result in a fatal condition that can cause a death in the individual. The types basically include the dilated cardiomyopathies that are quite common. Moving on, we have the hypertrophic cardiomyopathies, and then we have another variety which is known as the restrictive myopathies. Basically, we are talking about the restriction of the function of the cardiac tissue over here. So the arrhythmogenic right ventricular cardiomyopathies, they are again basically highlighted by their arrhythmias. That is, the heartbeat is deranged at this level. Either there is a tachycardia or either there is a bradycardia at this level. So we can have the dilated cardiomyopathies, which basically includes the familial dilated cardiomyopathy. Then we have the idiopathic dilated cardiomyopathy, which is basically a dilated ventricular chamber and a reduced contractility of the heart muscle. And then we also notice that there is no coronary valvular or pericardial disease in such a case. On the other hand, we have the hypertrophic obstructive cardiomyopathies, which includes an asymmetrical hypertrophy of interventricular septum. Partly obstructed left ventricular outflow is also observed in such a case, and we have the primary sarcomere disorder. And on the other hand, we have the autosomal disease, which has the same hypertrophic cardiomyopathy levels. We have the irregular sized large fiber in the myocardium, and at the same level, we have the interstitial fibrosis, which is quite common in such a case. And then we have the increase in the interstitial cellularity seen in such a case. So when we're talking about the restrictive cardiomyopathies, basically we are talking about whenever the cardiac muscle is restricted in its action, that is basically the contraction and relaxation, which is quite rhythmic, and it is obstructed in a particular way. The restrictive filling of both the ventricles and the atria. Then we have a reduced diastolic volume observed at this level. There is an increased interstitial fibrosis also noted at this level, and then we have associated with it can basically this condition of the restrictive heart disease. It can be associated with a lot of other medical conditions. It can be the cardiac amyloidosis. So it's basically the amyloidosis is basically a condition in which the amylin fibers are affected at this level. Then we can have the cardiac hemochromatosis, and on the other hand, we can have the endocardial fibroelastosis with or without the hypereosinophilia at this level. Now, the arrhythmogenic right ventricular cardiomyopathies that we were talking about, it's basically defined as a condition in which we have the primary myocardial disorder characterized by progressively fibrofatty degeneration of the right ventricular myocardium, arrhythmias, and the risk of the sudden death is also followed, or it is also seen in such a case. When we are talking about the arrhythmias, it is very specific to highlight the point that we're talking basically clinically. The patient is going to present with a state of bradycardia, that is, the heartbeat is going to be slowed down at this level. And on the other hand, we can have the tachycardias, that is the raised heart rate. So all of these are noticed at this level. And then we can have a familial autosomal dominant disorder that can result in such arrhythmias. As well as we can have the polymorphic phenotypes that are also going to present in arrhythmia state, that is the tachycardias or the bradycardias. Then we can have the two autosomal recessive forms at this level. So due to the infective diseases like diphtheria, the isolated myocarditis or the lesions are noted down at this level. And the necrosis or the degeneration is also noted down and is looked for whenever we are considering such a case of myocarditis. The inflammatory infiltrate has to be looked for, and basically we are talking about any infectious state which basically revolves around the cardiac tissue. Basically, we're talking about the necrosis and the degeneration that will occur after this infection has taken place. The necrosis, the type of necrosis that usually occurs in a cardiac tissue is the liquefactive necrosis that is observed in the cardiac muscle. And so we look for, even if when we'll send these slides to the histopathologist and the cut sections are sent to the histopathologist, he's basically going to focus upon the fact whether the areas of such liquefactive necrosis are noted down in that particular heart or not. Then we can have the inflammatory infiltrates even noted down at this level. And we'll have to basically focus on the eosinophilia. And the eosinophilia is the major highlight or the major evidence that the myocarditis has taken place at this level. So the diagnosis in the endomyocardial biopsies, even when you're performing the autopsy and the endomyocardial biopsies, they're taken out and they're sent to the histopathologist, he has to focus on all of these points, and the infections are usually caused at this level by the organism which is known as the diphtheria. So this is the usual slide that is basically going to show you the swelling of the myocardial cells, and then the eosinophilia is also noted down. The viruses that are usually the mainstay over here, and that they can cause a lot of myocarditis conditions along with the diphtheria as the bacterial organism over here. And then we can have the diagnostic possibilities also noted down. For example, we can resort to the PCRs. In situ hybridization is also focused upon whenever we are talking about such a condition. The drugs may cause myocarditis in a lot of cases. We have the myofibril necrosis seen. The bland mononuclear foci are also looked for whenever we are focusing on a slide of cardiac muscles. We have the fibrosis or the fiber necrosis noted down. And then we can have the myocardial amyloidosis also noted down. So we have the death in the old age. We have the senile myocardium at this level. There are no specific lesions. There's sudden breathlessness or the chest pain is observed. These senile hearts are usually small, and the hypertension is basically giving the enlargement to the ventricles at this level. We have the cardiac atrophies noted down, and the shrunken myocardium is also seen in an old age heart. We have the uneven myocardial fibers, and death usually occurs due to the trauma in the old age. So in this section, basically, we dealt with the different cardiomyopathies that can result in a cardiac insufficiency. So that is the end of this section. Thank you for watching Scardia.com.